Cardiovascular disease is very tough to manage because the symptoms often show up long after disease begins in the body. This situation can be thought of as an iceberg. The tip of the iceberg is just what symptoms are visible to the patient and the physician. The tip of the iceberg is cardiovascular disease. Cardiovascular disease includes heart attacks, strokes, heart failure, arrhythmias, heart valve problems, and more. This is what is shown and readily seen, but we have to be aware of the underlying causes. We must recognize them and continue to be aware of risk factors. The part of the iceberg below the waterline is what causes the disease in the first place. When it comes to cardiovascular disease, there are a few known lifestyle activities that are below the waterline. One of them is smoking. Smoking exposes you to toxins that can damage the blood vessels in your body. The risk of cardiovascular disease increases with the number of cigarettes per day, especially after many years. The first step in the management of cardiovascular disease is to create a plan to quit smoking. Consider telling your close friends and family about your new lifestyle change so that you have support while making this difficult transition. High blood pressure would also be under the waterline. High blood pressure may not cause you any serious problems in the short term, but when not controlled, it can lead to cardiovascular disease. High blood pressure will damage your arteries, making it harder for blood and oxygen to reach important parts of your body, like your heart. Another step in the management of cardiovascular disease is to control your blood pressure. If possible, monitor it with an at-home blood pressure machine. Controlling blood pressure requires lifestyle changes that might be difficult to implement at first, but with guidance from your doctor, it can be manageable. Those changes would include getting at least 30 minutes of exercise a day for 5 days of the week. This exercise could be as simple as taking a walk with your kids or your significant other. Managing your blood pressure also includes eating a healthier diet. For example, it's important to lower salt intake. Finally, if lifestyle changes aren't enough, talk to your doctor about medications that could be used to manage your blood pressure. While plenty of things fit under the waterline of the iceberg, a final one we'll talk about is high cholesterol. High cholesterol usually does not present with any symptoms, but a blood test will detect it. High cholesterol can cause fatty deposits on the walls of your arteries, reducing blood flow. If those deposits break off suddenly, they can cause a blood clot that leads to a heart attack or a stroke. Management of high cholesterol includes a healthier diet, more exercise, and quitting smoking. Finally, management of stress is important. Studies have shown that stress increases cholesterol short-term and long-term. Stress management looks different to everyone, but it's important to acknowledge. If you need a starting point, please view our video about eating for heart health.